Hello everyone, it's Charlton. Please subscribe to my channel, tap the notification bell, I'd appreciate it majorly. So, an additional video on the hydroxychloroquine. This is the malaria drug that at one point Trump was sort of touting as a possible real game changer and stuff. And I made a video about this before, and I'm going to talk about that a little bit as well. And I was doing this last night. I was a little overly excited, I think. But I saw, so I wanted to redo this. But I actually saw an article that's brand new from only 4 hours ago, overnight, that was published at Bloomberg about this a little bit, And it basically, the headline reads that the hyped malaria drug not showing much effect at one Paris hospital. There's been a number of small studies. There's been a couple Chinese studies. There's the French scientist, and he did two different studies. Rolt Didier, at some institution. I can't remember. He's fairly respected, even though I think he's a little on the flamboyant side and stuff like that. But both his studies that they did, they were quite small, and some think are questionable. But this individual, who's a practicing physician, he's the head of infectious diseases of this Paris hospital, and he said it didn't pan out, and they were hopeful, The individual, his name is Eric Combs. He's the head of infectious diseases at this Paris hospital, and I'll read to you what he said. And the Paris hospital is Pitié Salpêtrière Hospital, which is a huge hospital, okay? It's in Paris, and it's one of the largest hospitals in Europe, and it's the largest hospital in France. I mean, that's what I think it says here. Is one of Europe's largest hospitals. It is also France's largest hospital. So the head of infectious diseases at that hospital, I would think, is fairly respectable. Definitely a practicing physician, and so forth. But he says we've used it a fair bit because it was one of the hopes. Eric Combs, head of infectious diseases at the Paris hospital, said on BFM TV. But we don't have the impression that there's spectacular efficacy. It's even probably not effective. Combs said he would have more formal data around the end of the week. Okay, U.S. President Donald Trump touted the medicine as promising to curb the COVID-19 pandemic, fueling optimism and prompting some hospitals to stockpile it, but there's no conclusive evidence that it works against the new coronavirus. So that's just one additional article from I would say, a highly respected physician in a huge hospital, the largest hospital in France, saying, it hasn't, what did he say? We've used it a fair bit because it was one of the hopes, but we don't have the impression that there's spectacular efficacy. It's even probably not effective. Okay. So last night I was making this video about a couple stories that were published where it seemed like patients had, they believed that it actually was what saved them. Okay. And one was this woman from New Jersey. Her name is Margaret Novins. And the person who wrote about this patient, her name is Beth Pfeiffer. Okay. And I talked about this a little bit, and I'm not going to go into great detail, but the thing that I was mentioning last night, and this author who wrote a book, I think a pretty highly respected book with did a great deal of research on Lyme disease. That seems to be her field of expertise, or she spent a big chunk of her career writing about that and wrote a book about it. She wrote two follow-up, one article about this, and then a follow-up on it, which was just from 2 days ago, the follow-up, continuing to say that this patient feels like hydroxychloroquine, the malaria drug, the one that the France infectious disease department head of the largest hospital in France just said doesn't seem like it's showing much efficacy at all. That she believed it had saved her after she basically persuaded the doctor to give her the experimental drug or the drug. It's not. I mean, it's tested and safety tested and all that. It's an old drug. That's one of the things that gets repeated by people who are sort of promoting this as an option, hydroxychloroquine. The point I was making is that even between these two articles, this is the first one, the Forbes one, and then she wrote a follow-up over at NJ.com where she's just basically giving an opinion piece. They're both opinion pieces, basically. She fails to mention something that I thought was very critical. And she explains in both articles that, she has seen Margaret Novins' medication list. She's seen her medical history record on this case. She says that Margaret provided that to her. In both articles, she makes a point to say that. Okay, but in another article, a different journalist says that she was given remdesivir in addition to, Planaquil, which is the hydroxychloroquine. And I was just making the point that it seemed as though this author avoided mentioning that. Like, why is that a secret? Why is it that of the medications that she was given, one of them was another experimental possibility, drug for COVID-19, remdesivir, which has actually been, I've heard other physicians say, is a potential, really is a practicing physician. I mentioned this in my previous video, which I've now removed, but who before this all started, when I've been paying attention to this in quite great detail, like everybody, because we're all home. Who was basically said somebody who was very, very, very sick, and was just getting worse and worse, and then they gave that to him, and he actually got better, remdesivir. But why did this journalist neglect to tell us that was listed on her medication list when it's one of, along with hydroxychloroquine? So she believes that it's the hydroxychloroquine, and she's fairly adamant about that. And I can't go into her brain, either one of these two persons, and necessarily explain why. But when you're given two different experimental drugs, why we're only told about one by a particular journalist and not the other, remdesivir, I thought is worth noting, and that's what that's what I'm mentioning here. And I mean that's, believe me, remdesivir is not in this article. It's not in this article either. Okay, she mentions that she was given other Novins records which she provided show she was also on other antiviral drugs while hospitalized, factors that subsequent trials will need to consider in finding what works for COVID-19. For her, hydroxychloroquine and azithromycin seem to spur immediate improvement. The azithromycin is the Z-Pack, so it's that combo. And the title of this is about actually. It doesn't have hydroxychloroquine in the title. I'll give her that. In the Forbes one, I believe it does. It does. But there's no mention of remdesivir in this article. When over here at patch.com, which is actually written in between that journalist's initial article and her follow-up, it says Novins was discharged Wednesday from Novins is the patient, is this woman here, who's now at home feeling better. And she was discharged last Wednesday, I believe. Discharged Wednesday from CentraState Medical Center in Freehold, where she had been hospitalized for the past 10 days. CentraState is the same hospital where 4 members of one single family of Fusco's died of the virus last week. It's at CentraState where she was given a series of off-label drugs, including remdesivir, a drug originally developed to treat Ebola, which is a virus. Not all that. I mean, it's similar to coronavirus. I mean, it was developed to treat these kinds of viruses: SARS, MERS, Ebola. It was specifically developed for Ebola. Planaquil, the brand name for the anti-malarial drug, hydroxychloroquine, and azithromycin, an antibiotic with common brand names Zithromax and or Z-Pack. After being given the meds, she said she, quote, turned the corner, end quote, fighting the virus. And then this patient actually somewhat disputes the journalist to some extent, pushing back a little, saying that she doesn't necessarily, she says, quote, "I'm not comfortable saying it's that specific drug combo," said Novins. "I was given an HIV drug and antivirals. I think they really don't know yet what works. But I can say the first thing they gave me was the Planaquil and azithromycin, and I definitely turned the corner at that point." It's still a little vague, but this journalist is saying that she was given remdesivir. And basically the physician, the chief medical officer at CentraState, Dr. James Matera, confirmed that they are giving Planaquil, remdesivir, and azithromycin to, quote, some COVID-19 patients. And the point I was making is that in this Mary Beth Pfeiffer piece, who's an ultra-liberal, very, very liberal person. And she's, from New York, and she wrote for the Poughkeepsie Journal for a number of years. I had this sense that maybe she was a friend of Hillary Clinton. I have no idea if that's true, though. And she's a follower of Hillary Clinton and Chelsea Clinton on her Twitter account. That doesn't mean anything. She follows thousands of people. But I just had this sense that Trump loves to use people who basically, seem to be his polar opposite politically, to come to his defense in certain circumstances because they lend credibility, because they're against him, as it at least appears that way. And so, if they're speaking something that defends what he was saying, they bring a little more credibility to it. But in her articles, there's no mention of the word remdesivir, and I think that's worth noting. Another thing, just to understand, as I understand it, and that's what remdesivir was, is a lot of these drugs that, are in developmental stages for SARS and MERS and Ebola. What happens is these viruses, they go away. Basically, they run their course before the drugs reach the end of their development. And there's no need for them to finish development. So they just kind of stop on it. And that's just kind of what happens with these viruses a lot. And that's what remdesivir is. So it's more of like an appropriate candidate, in my opinion. But the other thing, and I mentioned this before, is that this particular journalist, she's basically retired. She says she's, retired, but, this is like her debut. She starts writing for Forbes right before this thing explodes, this giant crisis. And actually her first article, which is February 26th, this is right before everything's just about to completely blow wide open, and this is before anybody knows how serious it is, and she's just writing about Lyme disease, her expertise. But by the next article, she's starting to write about, COVID-19, and then the possible researchers look to old drugs for a possible coronavirus treatment. The old drugs is the malaria drug, and so it just seemed weird that she started writing for Forbes right before this whole thing exploded, and I pointed to this before, how Steve Forbes is following her because he's writing for his publication, and Steve Forbes, ultra conservative person, and initially she was the most recent person he was following. And Steve Forbes is a very famous person. He's on Fox News all the time. I believe he's a billionaire. He ran for president himself. Super, super conservative individual. That doesn't mean he doesn't have, left-leaning people writing for his publication. He's got 220,000 followers, and his most recent follower, up until a moment ago was Mary Beth Pfeiffer. And I just thought it was, I don't know, because Mike Lindell is now his most recent follower, who just recently was on the White House lawn, I guess it's the Rose Garden, when Trump was giving a press conference about COVID-19, and he's the MyPillow guy who's super pro-Trump. And he actually went up there to basically, say how, good of a job Trump had done, and is doing, and let's get back to what great stuff Trump was doing. I don't know, just the contrast of those two right next to each other. Said something to me, and that's the story there, man. That's the story there. So, but this most recent article basically says that, didn't show much promise. The malaria drug from the head of infectious diseases at the largest hospital in France, where patients are being treated for COVID-19. They were trying it. They wanted it to work. And that's the story there, man. Thanks for watching my videos. Please subscribe to my channel. Give me a like down below. And I will see you in the next video. Later, man.